Greetings from the Quillen College of Medicine. I'm Dr. Tom Quasigro, the Associate Dean for Student Affairs and the Director of our teaching programs in anatomy. This is the Anatomy Laboratory, where we teach medical students. There are 72 of those wonderful students that make our life terrific and wonderful and the reason why we're here. We also teach physical therapy students, and soon we will be teaching prosthetics and orthotics and occupational therapy students. That gives our students the opportunity to have a full interprofessional opportunity in a state-of-the-art institution, state-of-the-art program that is second to none in the country. Soon we will be opening up our Center for Surgical Innovation and Training, which is unique in the country for the opportunity to train medical students in surgical skills. Our students that are right behind me here will be continuing the tour for you.
One of the really cool resources we have in the Anatomy Lab is an iPad at every dissection tank. We have access to the Netter's Atlas, which is the gold standard of anatomy guides. We also have our own dissector guide that the anatomy staff has made, and we can follow along this guide while we're doing dissections, and it's a really great resource to use.
The Anatomy Lab at Quillen has 2 full-time staff that are here to support our education and maintain the lab. Our lab is special in that we are one of few schools in the nation that have surgical reality donors. These are donors that have flexible joints and are more lifelike, and so that we can practice procedures on them, whereas other donors are more stiff.
As one of the staff here in the Anatomy Lab at Quillen, it's our job to make sure that our students are fully prepared for their 4 years of medical education. Anatomy is the first class that students take, so it's part of our job to make sure that that transition into medical curriculum is easy. We have a very large lab space here, so the faculty and staff and the 72 students all fit in all at the same time, and there's never a faculty or staff member far away that you can get all of your questions answered in quick time.
We use a flipped classroom approach here in the Gross Anatomy Lab, and this allows students to have access to the material before they actually come into the lab. So when you get here, you can ask all the questions that you have from the day's material previous. And then when we do exams, we're actually going to have half the exam is going to be a traditional written exam, with the other half being a practicum in the lab with the donors. And this allows several pins to be in each donor so that you can see the variety of anatomy across many donors.
Our anatomical gift program provides students with a unique and compassionate experience. We only have the opportunity to learn because of people's willingness to donate their remains in the pursuit of that education. And so the entire course has a certain atmosphere of respect and gratitude for those individuals. So much so that at the end of the course, students have a memorial service for their donors where we get to express our gratitude and appreciation for all the valuable information that we've learned thanks to them.
In the gross anatomy course, each tank contains 1 donor, which will be referred to as your first patient. You and your 4 classmates will discover 4 potential pathologies that you'll present on at the conclusion of the gross anatomy course. As your career continues and you complete your first year, you will have ample opportunities for research using the various types of donors that we have available at the lab.
Thank you for joining us with this tour in a place where teamwork makes the dream work.